Catherine Vince-Knight at the School of Maths, but I'm also employed to work with Cardiff and Vale University Health Board. So if you're Cardiff-based, keep an eye out for me at the Heathrow. So I'm following on very much from Paul and Christos, as Paul mentioned, where I'm going to just talk you through a bit of system dynamics. So the reason we're talking through system dynamics in this particular context is that generally we're talking about a simulation method that allows us to consider quite a broad system view, a complex system. We're talking about just quite a simple simulation, so one where we don't have lots of random effects in there. But one of the key things that we're interested in is this idea of feedback. And that then allows us to explore the ideas of strategic issues. So it's that idea of feedback that I'm particularly interested in this context. And I want to run through just an example that has applications to health. So I apologise if some people have seen this example before. But if we were to think about waiting lists, and I apologise if you can't see these so well, but we've got in here the referral rate, the bed occupancy, and the size of the waiting list. And we know that there's a relationship between these three elements of the system. And what we might say is that, in turn, the referral rate influences the amount of occupancy that we have within our hospital. The occupancy that we have influences the overall size of the waiting list, and the size of the waiting list, in turn, might then start to influence the referral rate, whereby GPs might respond to that. So overall, we might think of this as a traditional sort of queuing system that we would model, whereby we've got a negative feedback loop in there. The point, though, in this particular example is to try and highlight some of the behavioural, in context of this whole event, the behavioural aspects. So what we might have is some unintended consequences that are happening within this system. So we might have the size of the waiting list influencing political pressure that's being placed on the system. That then might lead to some money for some extra beds, but that might then in turn, that money for extra beds will then increase the occupancy level within our hospital, which might help reduce the size of our waiting list and have an overall positive impact. However, this might have an unintended consequence on the referral rate as well. So this is the overall idea of system dynamics, of trying to get a broader view of a system, but trying to capture some of the overall dynamics of the system and see how the system might actually be interacting. What does that actually mean is we can then build it up into an actual simulation model. So although this looks like a nice hypothesis about how the system's working, we can start to look at putting some numbers behind that. So we can build that up into a simulation model, which might have this particular form. But actually what we're most interested in is looking at certain behaviours over time. Okay, so looking at how our occupancy level then is shifting and adjusting according to the amount of available space that we have. Our waiting list, which is the red line, might peak and then settle down, so we might not actually get an immediate effect of that reduction or that increase in the number of beds. So where does that actually fit in overall into current work? So I'm working on a project with an Iron Bevan Health Board with my colleague Doris Behrens, and we're looking at modelling unscheduled care. So just by looking at the literature and speaking with some experts in the field, we're able to get a picture of what are the actual relationships that are happening that drive people accessing unscheduled care. So if we were to think about this key point over here about an individual's decision to access service, that then is influenced by a variety of things, such as the quality of care an individual has received, the amount of previous experience that an individual has received, and that then filters through various different aspects of the patient's particular decision process. So this particular map is now built from healthcare literature, and we're able to draw some numbers from the healthcare literature, and the intention is then to actually represent this within the same sort of system dynamics model. The key point here, though, is that we have these feedback processes, where as patients are actually accessing care services, that's then feeding through in changing their propensity to access service in the future. And that's what we're wanting to try and model over time, is how that propensity to access service is responding and changing to how they've accessed services in the past, and also how well we're actually doing and how that influences. So overall, the identification of the links are coming through from the literature and through from experts in the field. One key element to this, though, is there are going to be elements within this model that might be more difficult to sense. And I'm using the word sense here because we're actually working with the group from SenseMaker in order to actually capture patient stories, so very rich qualitative information from the patients, in order to also then align some figures with this. So a patient might give their story and then they have to report on how that story would fit within the triad. Okay, so whether they were seeking comfort, reassurance or treatment. We're not judging on whether these are valid or invalid reasons for them accessing care, we're just asking what was their reasons for actually accessing care. Similarly, we might ask them whether or not it was the best place to meet their needs, whether it was the most convenient, or whether they just had a degree of uncertainty. And obviously there are interventions within the NHS that are trying to tackle each of these areas. We must try and understand, are people actually facing these challenges? You know, where do they position themselves within this triad? And then also more importantly is it might not be that particular individual that's making the decision. So it may be the healthcare professional involved, it may be the patient, or it may be a secondary decision maker. So we have to take into account the secondary decision maker's experience and process through the healthcare system. So overall, we're looking at trying to represent a model of unscheduled care, rather than this very linear system, but to try and, if we're thinking of what we want to improve, but to try and think of it as this feedback process. So we might want to address improving care, reducing readmission and moderating arrivals. We've got to take into account that feedback that's happening within the system. There's delays to that feedback, and there's also unexpected points of feedback within that system as well. I'm sorry, a bit of a lightning. This is Dr. System Dynamics. This is the project team who will be happy to talk about the unscheduled care project further.